it's associated with a 9 to 11% reduction in the likelihood of you getting it. So it really impacts on patients.
Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. I'm your host, Dee Moore. This is a space where we can have honest conversations about living with kidney disease, with knowledge, empowerment, and hope at the center. Today, this is part one of a two-part episode titled Beyond the Scale. Today, we're exploring weight, dialysis, and how BMI can affect kidney transplant eligibility. For many kidney patients, weight is not simply about the numbers. It can influence access to surgery, clinical decisions, and emotional well-being. Today, I'm joined by Dr. Adrian Brown, Associate Professor in Nutrition and Dietetics, NIHR Advanced Fellow, and Senior Specialist Weight Management and Bariatric Dietitian, who brings both research expertise and frontline clinical experience to this important conversation. Please note, this episode is for educational purposes only and is not a substitute for personalized medical advice. Always speak to your renal team or healthcare professional about your individual circumstances. Let's begin. Hi, and welcome to Diary of a Kidney Warrior podcast. How are you doing today, Adrian?
I am doing fantastically, Dee. Thank you so much for inviting me to have a chat with you.
No, thank you. And thank you so much for joining me. Honestly, it is a real honor to have you on the podcast here. I have been looking forward to this interview for so long, and to have the opportunity to speak with yourself, somebody who has actually helped me personally without even knowing it, really, really adds to the honor of you being here. So welcome to the podcast.
Thank you.
We're talking today about weight. We're talking about obesity, dialysis, transplant eligibility, and GLP-1s. We've got lots to talk about today. So before we begin, I wanted the opportunity to get to know you a little bit. So my first question is, can you introduce yourself and tell us about your role working with kidney patients?
Great. Thank you so much for that lovely introduction. So I am a researcher. I work at University College London. I am an associate professor in nutrition and dietetics there and an NIHR Advanced Fellow. By trade, I am a senior specialist weight management and bariatric dietitian. So I worked in the NHS for many years, helping people living with obesity to manage their weight, but also their health. I research all things obesity, and topics that I look at are things like weight stigma, ultra-processed food, but also more recently, I have started to look at kidney disease specifically. And so I have a 5-year government-funded project looking at people living with obesity and kidney failure on hemodialysis, and particularly focusing on weight loss prior to transplantation. So we're about 2.5 years in, so some exciting stuff has already been collected, and we'll hopefully be able to share some of that with your listeners today, which I'm really looking forward to. And so in terms of my journey to getting into kidney disease and obesity, that really started when I was in clinical practice. So I was a team lead for an obesity service in the West Midlands. And while I was there, we spoke to the kidney team, and they identified that they had lots of people within their service that wished to have kidney transplants. But unfortunately, their weight was impacting on getting access. And hence I started a clinic there when I was in clinical practice. And that really was designed to help people to lose weight to get listed for transplantation. And we got some great results at that time. And then fast forward a few years later, I'm looking for a topic, particularly related to obesity And kidney disease was there. And I asked a few dietitians and friends who are currently working in obesity and kidney disease. And I said, has anything changed in a decade? And they went, no. And I went, perfect. This really presents well for me creating some research that can hopefully help people to get better access to transplant.
As someone on the transplant list myself, and someone that's been on their own weight loss journey, it really, honestly, it warms my heart that you've had the passion to do this, because speaking for myself, and I know so many people have benefited and will benefit in the future from the work that you do and the research that you're doing. So on behalf of all of us on our journeys, I just want to say thank you for the work that you're doing, and, long may it continue. And I wish you continual success in this area. You're helping people to do things beyond what they ever thought possible. So thank you. Thank you so much.
Thank you for your really kind words. And I'm really pleased that now obesity is starting to be thought about more widely, particularly in kidney disease. And back a decade or so ago, it was really something that wasn't. And so I'm really pleased that this research and the work that we're doing is really well timed to hopefully help people.
So in terms of weight and why it matters for transplantation, I really want to look into that a bit deeper. So why does weight or BMI matter when someone is being considered for a kidney transplant?
Dee, that's a really important question. And I think what's important is we get a little bit of framing or background to this. And I think when we look at obesity in terms of the UK, in terms of prevalence, how many people have it, around 28% of UK adults currently are living with obesity. Now, obesity itself, independently, outside of potentially people having diabetes or high blood pressure, actually links to the progression of chronic kidney disease and the development of kidney failure, and ultimately people needing dialysis. So it's incredibly important that we look at weight. Now, in terms of the prevalence of obesity in the kidney population, we don't really have a lot of data related to that, but we did a service evaluation in London of 3 large centres. And what we found was 29%. So that's more than the UK average, were living with obesity. And so it really is an area that needs to be addressed in patients living with kidney failure. Now, you said before, how does weight impact on people's eligibility? And unfortunately, weight still potentially impacts on people getting access to transplant. So when we look at the likelihood of someone getting a transplant, if they are living with obesity, for every 1 kilogram per meter squared of BMI, so every point increase in your body mass index, so that's your weight divided by your height in meters squared, it's associated with a 9 to 11% reduction in the likelihood of you getting it. So it really impacts on patients.
That is very significant with each kilo. I mean, wow, that adds up very, very quickly.
Yeah. So the question is, why does weight potentially impact on that? Now, transplant teams and your kidney teams will look at your weight and look at your BMI, because what we see is that a higher body weight increases your surgical risk with things like wound complications or the graft not working or infections. And so what's important is that people aim to lose weight to help them to reduce down these risks. But also what's important is to understand that actually the operation is more technically difficult, because particularly around the waist, there's a vein that you need to access to get the new kidney in. And that is very difficult to access if there's too much fat around that center, around the waist. So what teens attempt to do is reduce down that waist size to improve the access to that. Now, the thing is that BMI is often used. That is often the criteria. That's the first criteria that's used. Now, it is very simple, but it is imperfect. It's not a great way of assessing person as a whole. We can assess a certain element of it, but what it doesn't do is it doesn't look at where fat is distributed or muscle. And so what we need to do is it's not just about using BMI, and surgeons won't necessarily just use BMI. What they will do is they'll look at someone as an individual and look at where that fat is distributed, particularly. So you've got two types of fat. You've got fat, which you would call central obesity or central fat. And then you've got gluteal femoral, the bum fat. Yeah. So people distribute it on different parts of their body. So they can distribute it on their bum, or they can distribute it around their stomach. And you'll know the people that will have those different levels. And so the central weight is the one that particularly will impact on the likelihood of you getting access.
I think, that is interesting because you can look at two people who are exactly the same weight and they can look completely different. And like you said, for someone who carries their weight in the back, but ultimately carrying the weight like that isn't as significant as if it's on the front. And is this what they call visceral fat as well? The one that, or is that different? Because I hear this term visceral fat all the time, but don't actually know what it is.
So what you have is you have two types of fats. Basically, you have what we call subcutaneous. That's the fat that you can pinch. So you pinch yourself and you can feel that the fat. That is subcutaneous. But what we also have is we have fat inside our bodies that surrounds our organs. And that is called visceral fat. And that visceral fat can impact on your health. So that when we lose weight, we don't just lose subcutaneous, we lose that visceral fat. So we reduce down the risk on our health. So that fat is particularly harmful. So that's the fat around your organs. Yeah, that's visceral fat.
An add-on question. So when we're talking about visceral fat, there's this term that they say people are skinny fat. So are skinny fat people that have more visceral fat than subcutaneous fat? Is that what it is?
So the way that our bodies work is we distribute fat differently. So some people distribute lots of subcutaneous fat. Other people distribute more visceral fat. And that is very much related to your genetics, Dee. And so people can have a lower BMI or body mass index or weight and still hold more visceral fat. And that will impact on your health. So although I don't like the term skinny fat, quote unquote, that term would reflect to these individuals that are of a lower body weight, but still hold this visceral fat that can impact on health.
The reason why I asked that question is, and something I'm very aware of in terms of people's attitudes towards obesity is people will make this statement, look at somebody who is bigger and automatically say they're very unhealthy, and look at somebody who's smaller and think automatically they're healthy. But clearly from what you're saying, that isn't necessarily the case. And so it really is for everyone to be taking care of themselves and not just going by looking on the outside, but ensuring what's going on in the inside. And especially as a kidney patient, where I'm always told, you don't look sick, you don't look sick. The same is true when it comes to kidney disease as it does with weight. You cannot tell by looking at someone automatically, you're healthy and you're not. So that was the reason why I wanted to ask that question.
Great, Dee. And I think you touch on a really important topic that hopefully we'll be able to explore later on, which is really around weight stigma and the ideas around how society and also healthcare perceive people living with a higher body weight, and that can potentially impact on care. So hopefully we can chat a little bit more about that later.
Oh, definitely. So now that we've established why the weight matters, I want to look at in terms of the reality for a dialysis patient. Again, as a dialysis patient myself, I really know the impact that the process of dialysis in of itself has on your body. It, you leave there and sometimes you just want to crawl into bed. But why is losing weight particularly difficult for dialysis patients? I mean, I've stated the obvious. We can be more tired, but what are the other reasons why it can be particularly difficult for dialysis patients?
That is a really important question. And actually, one of the questions that we actually have done in our research, Dee. So what I'm now going to share with you is the lived experience of people that have been on dialysis. And we asked them, what are the challenges to weight loss on dialysis? So there's lots of factors that they identified. So as you said before, physical fatigue. The impact of physical fatigue, both from a physical point of view, but also a mental point of view, really was highlighted by patients. And the impact of the mental fatigue and the resolve to be able to continue to make changes to their lifestyle to lose weight are incredibly challenging. Dialysis, as you have said, Dee, is incredibly hard on people. It impacts on their life, it impacts on their relationships, it impacts on their mood. And people said that they felt that they got no real break from dialysis. When they were on dialysis, when they went to the unit, it was a whole day. And then the day after, they felt exhausted. So there was never really a true break from this. People also identified that fluid was so challenging. Often when you speak to someone without kidney failure that doesn't have any issues with fluid, you would say, drink some more fluid to help you with your hunger. And unfortunately, people can't do that. And often that might impact on their ability to not feel hungry, but also they reported around dehydration and the impact of that on their blood pressure, particularly around dialysis. But furthermore to that, there was also a sense, Dee, of what we call weight guilt. So people doing lots and lots of positive things, but then their weight not going down. And it wasn't necessarily that their flesh weight wasn't going down. It was that their fluid weight wasn't. And it was like, well, I've put in all this effort and my weight's the same. So that difference between the two is important. They reported a lot of conflicting advice between healthcare professionals. So multiple clinicians saying multiple different things for multiple different conditions. So who do I listen to? Do I listen to my diabetes dietitian or my kidney dietitian or my heart doctor? And that confusion often meant that people struggled to know what dietary advice was the most important. The role of support was also incredibly important. So families and other members of the team, they felt that they didn't truly understand what it was like to be on dialysis or have kidney failure. They were there and they were supporting, but they weren't fully aware. And so that could potentially impact on them in terms of that. And so what they the real sense was that ultimately dialysis is incredibly challenging. It impacts on their ability to lose weight. And because of that, when we're thinking about interventions, or what we do to help patients, we really need to be thinking about the challenges of dialysis in anything that we do.
What are some of the misconceptions people have about weight in kidney patients?
That is a great question and very nicely moves on to what we were talking about earlier on. So there's a major misconception about weight and it being personal responsibility. So, i.e., you should simply eat less and exercise more. And that is the solution to weight loss. But that is not what the evidence suggests. So the evidence suggests that obesity and your weight is driven by a mixture of many factors. Actually, when we look at the research, there's over 100 different factors, that impact on your body weight. So that could be your biology. That could be the environment that you are in. That could be medications. That could be stress. That could be mobility. But also, that could be your genetics. So, your body weight is heritable. So, it's heritable from your family in terms of your genes. And that ranges between 40 to 70%. So, actually, your genes play a huge role in the likelihood of you developing a higher weight.
40 to 70%.
Yeah.
That is high. I mean, that's really, really significant. When you see some families where everybody's overweight or everybody's really skinny, it really shows that, wow, 40 and had no idea it was that high.
Yeah. And those genetics play a role on how hungry someone feels, how they distribute their fat, how they respond to meals, but also how their brain responds when they eat as well. When we scan people's brains living with obesity and we show them higher fat foods, i.e. foods, what we see is those reward centers, those areas in the brain that light up when we do something nice, light up more than people with a lower body weight. So actually those reward centers are also driving it. And I love this phrase, and I don't know who I need to reference this to, but it's a lovely phrase that says, genes loads the gun, environment pulls the trigger. Because our environment also plays a significant role within the likelihood of developing a higher body weight. So particularly things like accessibility to food, particularly high fat, sugary, salty foods. But also we need to be appreciating that socioeconomic factors, so deprivation and poverty, also significantly impact on our food choices. So it's not a fact of simply having the willpower to eat less and exercise more. There's multiple other factors that impact on it. However, unfortunately, society still views it as personal responsibility, and hence people are judged on their body weight. So there are stereotypes, there are attitudes, there are beliefs about people of higher body weight that distill not just into our wider society, but also, unfortunately, our healthcare as well. And that has been shown to impact on care. So a particular interest of mine.
I was having a discussion with my best friend about this topic, and it was like, she has been on her weight loss journey as well, and she was saying that, when you're obese, everything's because you're obese. You could go to the doctor for anything, and it's like, well, you need to lose weight. And I think it was social media. Somebody said, when you go to the doctor and you tell them what's happening with you, say to them, pretend I wasn't obese. What would you tell me?
Yeah.
And it's quite frightening, actually, because so many things can be missed if you're automatically just putting everything down to weight. And I know that weight is significant. We can't move away from that, but it isn't to blame every single time. So for myself as well, I've definitely experienced where that has impacted, when I was heavier, that has impacted the assumptions when I'm talking about whatever issue that I've got with my health at that time. So speaking personally, I've definitely seen that for myself. Has there been
Yeah.
any research around that in terms of testing?
Oh, there's been lots of research. You nicely feed in. So, so when when we look at stigma is across our society. So, for example, weight stigma is in media. So when we look at media coverage of people living with obesity, what you'll see in newspapers, if you look at an image that describes obesity, often it is what we call a dehumanized image. It is lacking a head. It's often just the stomach. There's a tape measure in there. Or if it is of someone living of a higher body weight, it's of them eating junk food. When we look at movies, for example, the movie characterization of people living with obesity often is of the jokey, fun person, isn't the love interest, and is often the butt of the joke. And that's how they portray them. When we look also at education, it's impacted on education. When they look at PE teachers, they view children of a higher body weight as less able, less fit instantly. But that transcends into adult life as well. So what we see is that individuals at work, women of a higher body weight are paid less than people of a lower body weight. But also that impacts on our access to healthcare as well. And this is where I'm particularly interested in. So when others have done research, and this is data from Rebecca Poole in America, they identified that 69% of doctors had weight stigma. Dietitians as well, 39%, and also nurses. And this transcends. And what we notice from that is that stigma directly impacts on whether patients are referred on to further treatments. And this particularly impacts on women, particularly. So they're less likely to get physical examinations. They're less likely to get cervical smears, which is really shocking. And this impacts on whether people are referred on to obesity management services as well. Because if it's judged as personal responsibility by a doctor or by another healthcare professional, it should be your role, then why am I referring on? You should be able to do it because I can. And so this is why we're particularly concerned about those elements when I am looking at my research and how this potentially impacts on kidney care. And we've got some unpublished data, which I might be able to share later on, actually for the first time looking at weight stigma in kidney healthcare providers.
There was so much there that I found shocking in what you said. I mean, I'm very aware from personal experience how some doctors can be blaming obesity for everything. But to say that not referring you for cervical care because you're obese is absolutely disgusting. I'm just really shocked by that. And to the percentage being so high of doctors, and then included in that is dietitians. Like,
yeah, unfortunately.
I mean, I find that crazy. I mean, surely dietitians of all people, I would, oh, that's really, really shocking. I mean, so if they have that attitude as a health professional, what chance is there for these patients then? I mean, we're talking life and death situations here where if you're not referring people for cervical care, I mean, that can lead to cancer, that can lead to so many complications, and that's just one area. I mean, wow. Sorry, that's really shocked me.
Yeah, and I think this is the reality that we have. We almost imagine that weight doesn't impact on care, but it does. It impacts on people's access to care. And so what's important to appreciate is that when we are looking to reduce down stigma, a lot of this is around awareness. And we'll hopefully talk later on, particularly around the ideas about how we communicate. Because what we know is that those experiences when someone goes and sees a healthcare professional that are stigmatizing, what that results in, that doesn't result in greater weight loss. That actually results in weight gain. It results in people actually having more emotional eating, more comfort eating, and actually results in people wanting to avoid going back to that doctor or that dietitian or that nurse because they feel stigmatized. And so a lot of the work that I'm wanting to do and I'm doing is really around education and sharing that message about the impact of weight stigma on healthcare, and particularly on the impact of that on that patient practitioner relationship that's so incredibly important.
So how, as a patient then, how do you combat that? I mean, again, speaking personally, when I started dialysis, I was on peritoneal dialysis. And unfortunately for me, peritoneal dialysis did not work. And so I was continuously gaining fluid for the whole time that I was on peritoneal dialysis. And it wasn't until I was on hemodialysis and they started taking that fluid off that all of a sudden I'm a stone lighter just from fluid. Now, anyone looking at me would be like, oh, you've gained weight, but actually it was all fluid and that was outside of my control. And so as a patient going through, you've got the stress of dialysis itself, you've got all the different things that you're experiencing as a kidney patient. How do you then navigate those attitudes as a patient when you're going to these health professionals for help and support? How do you combat these kind of attitudes?
That's a really important question. And we did some research a few years ago looking at how we address weight stigma in healthcare. And what we found was that education, understanding obesity as a complex disease is some of the first steps. Understanding that it's biological and it has genetic factors. In addition to that, we found that actually meeting people and having a positive experience with people living with obesity and clinicians actually help them to understand that aspect. Also, what's important is talking about language and talking about using non-stigmatizing language. So the way that advocacy, and particularly in obesity, has gone is we are trying to move to what we call person-first language. So putting the person in front of their condition. So the way that we attempt to do that is say a person living with kidney disease, or a person living with kidney failure, or a person living with obesity. We try to avoid these stigmatizing words, things like quote unquote morbidly obese, quote unquote chubby. And we did some research looking at preferred terms of patients related to their weight and about what terms they prefer healthcare professionals to use. And what we found was that the term quote unquote weight and quote unquote unhealthy weight were the most preferred terms. But the least preferred terms were quote unquote obese, quote unquote fat, which were often terms that might have been used by healthcare professionals, but really resulted in a really negative emotional response from patients. The challenge that we have is that we have two types of stigma. We have what we call explicit stigma, that's conscious stigma. So I'm aware that I am biased or I discriminate against someone because of a characteristic. And there's 9 protected characteristics, but weight is not one of them. then we've got that conscious one, but we've got what we call unconscious bias. That's called implicit bias. And that is the bias that we have that we are unaware of. And that results in us behaving differently towards people without us even knowing it. And so the research shows that the education really works well in the short term for the conscious bias, but really challenges to break down that implicit bias. So as healthcare professionals, we really need to be aware of our biases because everybody has biases. It's not that they don't exist. It's about being aware that we might behave differently towards people because of a certain characteristic, weight being one of them.
I have to ask this question.
Yeah.
So is the reality that when you've got a transplant surgeon, and speaking personally, I've been in this position, if they're looking at if they're selecting somebody for a kidney transplant and they're looking at the numbers in front of them, and one person has a healthy BMI, or should I say, one person has what is considered a healthy BMI, and the other person has considered an unhealthy BMI. Are they always going to go for the person who has what is considered the healthy BMI?
It's a really important question. And obviously, I'm not a surgeon. So I think what's important is speaking to surgeons or transplant surgeons, particularly around this. Having spoken to many of them, they individualize that care. So they will individualize it to the person. And I think that's incredibly important. So what I don't want your listeners to get in their minds is that instantly I walk in and because I have a higher BMI, they're not going to consider me. As we said earlier on, body weight impacts on the risks of having surgery and having a transplant and eligibility. It impacts on the progression of your CKD and you going on to dialysis. And so what the surgeon will do is they will look at you as a person, as a total person, because it's not just about your weight. There's other things that they consider. They consider your heart health. They consider your wider health as well, and other factors that will impact on the safety of you having a transplant. So I think what I'm trying to represent, particularly with talking about weight stigma, is really about making people more aware that it exists initially and that we need to do something about it. Because ultimately, there's also something called internalized weight stigma. And internalized weight stigma is where people living of a higher body weight believe the stereotypes that society places on them. So, for example, I'm lazy, quote unquote. I lack willpower, quote unquote. I'm unable to stick to my plan, quote unquote. So those are stereotypes that society places on people living with a higher body weight. But this internalized stigma is where people living of a high body weight take those and believe them to be true about themselves. And so I've had patients come in and say, when we've had discussions and they've talked about weight and they've talked about, what do you think impacts on your weight? And I've had, unfortunately, people they've said, because I'm lazy, because I can't do it. And then we have wider discussions and we find out the person is full-time job. They take care of a family. They do other activities. And so if you looked at it objectively, you say that person no way is what we would define or imagine as someone that would be lazy. But those societal pressures impact on them. And that has been shown to impact both on psychological well-being, so their mental health, but also, unfortunately, their physical health as well. So there is a long way to go, but I really think we're starting to make headways in the wider society, but also hopefully some of the research that we're going to continue to do will help it within the kidney community as well.
One thing that I wanted to touch on very quickly was the impact of medication, because speaking personally, when I first started my journey as a kidney patient, I was put on heavy duty steroid medication, and I swelled up so quickly. Like in 1 month, I'm sure it was about a couple of stone heavier, and and it was overnight. I just swelled up so big, and I felt terrible, especially as somebody who I had fought so hard to lose weight. It took me over a year to lose over 3 stones, and yet in 1 month, I'd swelled up so big, and this was because of the medication. And for someone to look at me and judge me for being overweight, for being obese, as people will label people, and definitely trying to move away from terms like that, but over something that I had no control over and ultimately needed to save my own life. It's people don't consider that either, the impact of medication, and you have to take it. You've got no choice, and it has this massive physical impact, and it does make you feel really bad.
You bring up a really important point there, Dee, and it's about how society values weight. And we call it the quote unquote thin ideal, this ideal that value is based on a number on the scale. And I think for any individuals that have these experiences where they gain weight because of medications, all that variation between dialysis is that they're compassionate to themselves around these experiences. You needed that medication, Dee. Yeah, that medication was doing a role. And so I think there's very much around discussions that we can have with people when we put on certain medications around there will be a chance that you will gain weight. We will support you in that process, but also potentially afterwards to help you to manage that weight gain or potential weight gain. And so appreciating that your value is not based on a number on the scale. I think that's so important to remember, and that it's not a personal failing on you. And it's appreciating this might be for a period of time, but actually we can do something potentially afterwards to help you.
So what is a safe approach for weight loss for someone on dialysis?
That is a really important question, and one that we're trying to answer at the present time. So when we look at the evidence for weight loss interventions for kidney patients, actually there is some good guidance, but actually overall the quality is limited, and there's limited evidence, particularly in this area. The strongest evidence that we had previously was particularly around the use of weight loss surgery. But in terms of sort of evidence-based approaches for dialysis patients, achieving sort of small achievable changes with the help of your team is really important. And I think that's one of the first steps, making those small long-term changes, because it's not about making huge changes. It's about making sustained changes in the long term. 1 or 2 changes that stick around for a lifetime are better than 10 changes that you do for a month and then you return back to your old lifestyle and then the weight goes back on. Getting support from your kidney team is incredibly important, as they will be able to help you. And if there is access to local services, obesity services, that's really important to do as well. Having some gentle, regular activity is important. So such as walking, resistance bands, assuming you're able to mobilize, and being mindful around doing it at times when you don't feel fatigued after dialysis. So it's about timing of that physical activity as well. And maybe you don't do it on the days of your dialysis, but you do it on the days that you do feel able to. I think also thinking about sleep's incredibly important, and it's one of those key pillars, and being mindful of that. Now, there's lots of potentially dietary changes or nutrition-based approaches that can help people to lose weight. And I think the important thing to do is, if you plan to do one, speak to your kidney team, because there might need to be adjustments related to your protein, your bloods, particularly things like, potassium and phosphate, but also around fluid as well. So having that team approach can really help you to make those long sustained changes. But what's key is getting support.
Are there approaches that should be avoided?
Very interesting. Yeah. I think it goes on the opposite side. I think you should avoid doing it by yourself. I think what we notice and see from the literature is that individuals that are supported do better than individuals that do it alone. Avoiding crash diets. So these are diets like the cabbage soup diet, or suddenly taking out one whole type of food completely and avoiding that. Unsupervised weight loss outside of your team, as I've said, but also thinking about going onto the internet or getting over-the-counter pills, those types of things, because they potentially can have worse impacts, and they can interact with your medications, they can interact on your dialysis. But what's really important is that people do not do GLP-1 receptor agonists, these GLP-1 weight loss medications alone. So avoid going to get them prescribed privately without first speaking and discussing with your kidney team, and particularly those individuals on dialysis or on other types of renal replacement therapy, because that is so important, because we need wraparound care. We'll talk about hopefully GLP-1s in a bit, and I'll re-emphasize some of the challenges with that, but that's really, really important.
Before we close today's episode, I want to acknowledge something. Conversations about weight and kidney transplant eligibility are not easy. They can bring up frustration, vulnerability, and sometimes fear, especially if you're navigating dialysis and being told that BMI may influence your access to a kidney transplant. If that's something you're experiencing, you're not alone. This conversation isn't about blame or shame. It's about understanding the system so that we can better advocate for ourselves within it. In this episode, we've explored how weight can influence transplant pathways, the realities behind BMI thresholds, and the emotional impact these policies can have. But for many people listening, the next question becomes, if weight is affecting my eligibility, what options are actually available? In part 2, we continue this conversation and talk specifically about GLP-1 medications, what they are, how they work, and what kidney patients need to consider when thinking about weight management and transplant eligibility. If this episode resonated with you, make sure you follow or subscribe so that you don't miss part 2. And if you know someone navigating kidney transplant eligibility or considering GLP-1 treatment, please consider sharing this episode, because informed patients are empowered patients. Remember, you deserve information, you deserve options, and you deserve to be part of the decisions about your health. Until next time, take care and choose to live.
Diary of a Kidney Warrior podcast, in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.